I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. Our guest today is Justin Steinberg. Welcome, Justin.
Thank you very much for having me on here. I really appreciate it.
Well, Justin, let's get to know you. So tell us about yourself.
All right, so I'm 33 years old. I'm a research assistant at Stanford University. I serve on the board of directors for AADMD as the self-advocates representative. I'm a percussionist in a symphonic band here in Palo Alto, California. And I'm also a Special Olympics athlete leader, and board member.
Excellent. So we've got a lot of things to talk about. First thing I want to say is we are coming to you from the AADMD, the American Academy of Developmental Medicine and Dentistry Conference in Denver, Colorado. And you're a board member, you mentioned, right? And you're a self-advocate, right? Tell us about your abilities and differing abilities.
So I'm really good at public speaking. I've been trained as a Special Olympics global messenger. I've gone around and gave speeches. Public speaking absolutely does not scare me. I play all kinds of sports with Special Olympics, including flag football, floor hockey, basketball, track and field. I've done swimming. I've done softball, and I'm going to try golf. And as mentioned before, I play drums. I'm a percussionist in a symphonic band in Palo Alto, California. I'm on the autism spectrum, and I'm visually impaired, so I'm not able to drive. But I also have a master's degree in spite of some of my obstacles that I've had to overcome.
So were you ever told that you weren't going to be able to get a master's degree or anything like that?
When I was first diagnosed with my vision impairment, they actually misdiagnosed me with a severe intellectual disability and told me I wouldn't even be able to go to school. Yeah, they had no idea what they were talking about. I graduated
That's clear.
I graduated from high school in 2008 with like really high honors, no advanced placement classes. My GPA was like a 3.8. Completed an associate's degree at community college at Foothill College in Los Altos Hills with honors. Then I transferred to San Francisco State, where I completed my bachelor's degree in history cum laude, and then got my master's in special education with an emphasis in visual impairments, along with the Graduate Student Award for Distinguished Achievement, because my final semester of graduate school work, I got a 4.0 for that semester, and I graduated with a 3.77 grade point average.
Congratulations, and that is extremely impressive. That's amazing.
Thank you very much.
All right, so you said something when you were talking about the numerous sports you competed in Special Olympics, something about a global messenger?
Yes.
What is that?
So I'm trained to give public speeches, and I go around the Bay Area and advocate for inclusion, share my story about how Special Olympics has impacted me, and I try and help with fundraising. I've even gotten to go to Washington, D.C. in 2020 before the pandemic shut everything down and advocate for federal funding for our school's partnership and healthy athletes programs.
I bet you've gotten to meet a lot of interesting people doing that.
I did. I got to meet former Speaker of the House, Nancy Pelosi. I also got to meet Maureen McCormick, a.k.a. Marsha Brady from the Brady Bunch. And actually outside
Marsha.
Yep, and outside the Capitol Hill building, we just broke out spontaneously into a rendition of Sunshine Day.
I wish we had a recording of that. I bet you do, don't you?
Yeah, it's on my Facebook page. But
okay, excellent. All right, so let's see. You mentioned percussionist. All right, so tell me about that. How long have you been involved in that? And are you in a band or what do you do?
So I've been taking drumming. I took drumming lessons starting at around 7 or 8, and I was in the high school band in Palo Alto at Gunn High School for all 4 years. I played at the community college at Foothill for a little bit. I then found the Palo Alto Adult School Symphonic Band, which I've been a part of since 2009. I took some time off of that when I went to San Francisco State, and I joined the wind ensemble there, and I also joined the orchestra during my final semester of undergraduate work. And yeah, I've just been playing percussion for a long time, and my strongest instrument that I play is probably the timpani.
That's what I was going to ask you, is what's your favorite percussion instrument? So the timpani?
Yeah, just because it's challenging, but it's not like too difficult. You have to tune the drums with your pedal for a specific pitch, and just getting to like do like loud rolls and like tricky rhythmic patterns is just very, very, very satisfying.
Yeah, the timpani is something sometimes you don't always pick it out, but it adds so much to the sound of the orchestra. Sometimes it's clear to pick out, but this, the rumble in the back or the way, I don't know. It's a pretty neat instrument.
Yeah, it's one of my favorites. I've actually had a few solos on it.
Excellent. So, one of the things I like to touch on here is health and wellness. Tell me about your experiences accessing healthcare. I know you mentioned that you were misdiagnosed earlier with a sort of significant intellectual disability. What about your general overall healthcare needs? Or how does that go for you?
I've actually been very fortunate enough to have I had a really good pediatrician. I had really good ophthalmologists who understand my disability pretty well. And my current doctor that I have also, he's really good at listening to any concerns I might have. I think the only barrier that I have to deal with is because I don't drive, transportation is a bit of an issue. I have to rely basically on my parents or public transportation. And I have to be honest, the public transportation system in the Bay Area is not very good. But overall, I've had really, really positive experiences. And during the pandemic, I actually utilized telehealth, mostly for my mental health. I found mental health, telehealth is good for the mental health aspect. I think when getting physical exams, it's really better to do that in person.
Yeah, I think there are a lot of things that we've learned a lot more about how telehealth can work, and some things you do need to be there in person. But there is a lot that you can cover without being there in person as well too. But certainly the mental health aspect of it is a benefit for sure. Great. So, what else do you want to talk about? What else do you want people out there to know about you, about the advocacy work that you do? Tell us more about that.
So one of the things I stress is that you need to stop using the R word. It's a horrible word. It's extremely offensive. Part of my advocacy work, I've told, medical students how to properly care for people with IDD, and that's actually one of the big things. Another thing to keep in mind is treat a person with a disability as a person first. Get to know them and get to know their story. And ask them for what accommodations might be useful. Ask them about their communication style. Being on the spectrum, I can talk, but other people with autism, they may do better, especially because doctor appointments can be stressful. Ask if they would prefer to maybe write things down.
Okay, that's a good point.
Also, you do have people with disabilities who are nonverbal. Do try and talk to them first, and then ask if it's okay if you talk to their caregiver or their parents. But always try and get them involved to the extent possible. That's
excellent advice. So if you've got some advice for people out there, what would it be?
Don't let a label stop you from going out there and taking names and taking charge in the world. You'll find your niche.
That's excellent. And everybody has differing abilities to do different things. And you have fantastic abilities to do a lot of things. Musician, athlete, advocate, public speaker. Fantastic. It's excellent.
Thank you very much.
So one of the things I like to do is something I call 3 and 3. So I'm going to ask you to give people out there 3 things that you would like them to know. And we've touched on a lot of them, and it's okay if you repeat them to emphasize them. But 3 things in 3 minutes that you want people to know about people with disabilities, people are related to healthcare. Doesn't have to be related to healthcare, but 3 things in 3 minutes. Go.
All right. The first thing people need to know is that people with disabilities are people first. So don't infantilize us. Don't talk down to us. We can actually understand a lot more than I think people give us credit for. Another thing is when it comes to healthcare, if it was up to me, healthcare providers would help with, providing transportation. Because that's just such a big barrier. And of course, healthcare, like telehealth, it has its pluses and minuses. It's very useful for mental health. But for physical exams, it really needs to be done in person. And it also does depend on the person with a disability. Some people with disabilities have tried telehealth, and that lack of physical connection makes it impractical for them. So just keep in mind that people with disabilities will respond to telehealth differently.
That's all great advice. Let me go back to the transportation thing, and I want to expand upon that a little bit more. Access to healthcare and transportation is one of those components to it. Relate to things we call social determinants of health, and you've got to be able to get places, right? Being employed is another aspect. Education is another aspect that affects our overall level of healthcare, and it sounds like transportation is one of the bigger challenges for you.
Yes, because as I've said, I'm considered legally blind, so I can't drive. So I either have to take public transit. There is paratransit available, but unfortunately, I feel like that particular system, it's grossly unreliable, and people with disabilities are kind of left with the short end of the stick with that system. An example, I was waiting for it to take me home from work once, and it came on time, but it took me over an hour to get home because we had to go pick up another patient in like another city, and it was just... I don't only live like 10 or 15 minutes away from my job. So it was not fun.
Yeah. Well, you shared a lot of wonderful things, a lot of insight. It's great getting to know you, Justin. You have any jokes for us?
No, I think I'm all joked out, unfortunately, today.
No, come on. We were going back and forth earlier about, we were talking about trigonometry and geometry, and I thought you were just continually talking in circles.
Yeah, you know what? To get through those two classes, you really got to know all the angles.
That's a very acute observation, if I had to say so myself.
I hope I'm not coming across as obtuse.
All right, I think we'll stop with that. This was great. Really wonderful talking with you. Thank you for taking the time to talk with us today, and thank you for all the work you do in this.
Thank you for having me. It was my pleasure to talk to you.